Neutering is among the most common procedures that cat owners consider for their pet. In today's Zooplus magazine, we'll take a closer look at when this intervention makes sense and what the benefits, risks, and side effects are. There are two terms that are often confused or used in the wrong context, so let's start by clarifying them. Neutering refers to both castration and sterilization, and both of these can be carried out on male as well as female cats. You can find out all about the details and differences below. In general, the animal's health and behavior patterns can be deciding factors. The reason for neutering outdoor cats, on the other hand, is usually birth control. Theoretically, female cats can have 2 to 3 litters per year, with an average of 4 to 5 kittens each time. From an animal welfare perspective, the aim is therefore to prevent uncontrollable reproduction. Factors that speak against sterilization in female cats. The operation itself takes as long as a normal castration, and the risk of permanent heat cycles due to the constantly present hormones and secondary diseases is too great. Male cats may continue to mark. Therefore, castration is more common nowadays. Cats become sexually mature at around 6 months of age. The surgical procedure is often carried out soon after that, but this is not always necessary. If there is no risk of pregnancy, and the cat's sexual behavior is not pronounced, such as marking or heat cycles with crying, it's better to wait a little longer. This enables a completely natural hormone transition and allows both male and female cats to grow up stress-free. There are two methods, chemical and surgical castration. With the chemical method, pregnancy is simulated in the female cat by using progestogen. This is administered by tablet or injection. In male cats, a hormone chip can disable fertility.
Gut, dann müssten wir noch einmal wiegen.
The surgical method is the most common and practical one for domestic cats. The operation is performed under general anesthetic on an outpatient basis at the vet's practice. The patient can go home after a few hours. Of course, there are differences between the sexes when it comes to the details of the procedure. In both cases, the vet removes the hormone-producing organs or glands. In male cats, the scrotum is opened with tiny incisions. The spermatic ducts and blood vessels are tied off, and the testicles are removed. The procedure is more complex in female cats, as the abdominal wall must be opened to remove the ovaries. It is not uncommon for the uterus to be removed as well. This is often the case if the female cat is older or if pathological changes to the uterus are detected. Spaying a female cat is a routine procedure, but it is more complex and expensive than neutering a male cat. An operation on a cat's body is not insignificant, and there are risks and consequences that you should be aware of. Your vet will make you aware of them and explain them to you during the preliminary consultation.
Alles gut gegangen?
After the operation, you'll need to take care of your cat. If the operation is in the morning, you can usually collect your pet in the evening. Make sure there is a quiet, warm place available where your pet can rest undisturbed. preferably with no jumping or climbing opportunities to prevent any risk of falling. Female cats have a recovery period of about 10 days. The abdominal wound will have healed by then, and the stitches can be removed. Male cats are usually back on form a little faster. Keep a close eye on your cat during the recovery phase so that you can tell your vet promptly if there are any complications. After neutering, the energy requirements of both male and female cats will be about 30% lower. This is mainly due to the hormonal changes and starts 48 hours after the operation. You can either reduce the amount of food, which is not likely to make you very popular, or you can switch to a cat food specifically tailored to the new energy requirements. You can find products specially designed for neutered cats from manufacturers like Concept for Life in the zooplus shop. Castration and sterilization are routine operations. However, they can be complex, and the decision should not be taken lightly. In any case, you should visit the vet for a consultation to explain the reasons and to weigh up the risks and benefits. We hope you've gained some valuable insights to help you do the right thing for you and your cat. See you soon on this channel and in the zooplus magazine.